really the chiropractors, and one in particular, his name is Dr. Adam Del Torto, and he created something called the CFR, which is the cranial facial release. He basically inserts balloons up my nose and inflates them and adjusts my head and basically, I want to say he opens up the airways and the oxygen flow and brings blood more to my brain. And most people with chiros think that they're quacks, think that they're no good. But guys like Dr. Turk, who I'm seeing today, who's been with me for several years, Dr. Harold Turk, and M. Del Torto, Dr. M. Del Torto, and Joanne Bittner. I've actually got 3 or 4 chiros who are really always working with me, maintaining my spine, readjusting me, recorrecting me, and where the MDs and my neurologists, they want to give me a pill. These guys put their hands on me and position on my body and take away the pains and the aches on site. Where my neurologists, and they're great people, here's a pill, here's a Vicodin, here's a Narco, here's a Xanax. And the chiros are more of the Western side, where they're looking for different, I'd say, supplements, or more organic or more holistic, or just different modalities to really help put the body back together. And that's really a huge thing for me, our chiropractors. However, there's a disconnect between the MDs, a normal medical doctor, and a chiro, where an MD thinks, oh, I went to school for 12 years or 16 years. The chiro will go to school for undergrad, and they go to chiropractic school for a few years. And the chiro cannot administer drugs or prescribe medication, which is fine. They prescribe more of the holistic approach. Hey, what are you missing in your diet? They look at it from a head to toe look and feel, where it's diet, it's food, it's supplements. Hey, you may need to take more of this and less of that, and let's really heal you on more of a plant-based diet, where the MDs want to give you a prescription. They want to do the X-rays, they want to do the MRIs, which are fine. But listen, as a stroke survivor, we all know that this part of my head, if you look at an MRI, which I took last week, there's parts of it that are black, and that means it's either dormant or dead. And these chiros are saying, wait a second here. You have a whole brain that can actually still work, and the neuroplasticity can connect it. If I can readjust your spine and get your fluids going properly, we're going to maximize your brain to use what you still have to get things back. And I believe the chiros were really the ones who got me back here. Got me back to them and the therapists, the physical therapists, because they're such hands-on. Most people are scared of that adjusting my neck, because I do have a stent here. But these chiros are so careful, and they're so good at what they do, that I do need alignment. I do need, because I still walk, I'd say funny, or walk with a limp. And I still walk, not normal like I used to. So they have to go in there once a week and really adjust my spine. And I hate to use the word crack, but really do their own, way and feel with their hands and get my body back proportionally. Well, the first thing is I would look at, a chiro. Are they caring? Are they a friend? Are they someone who understands your condition? If it's a brain injury, if it's a stroke, if they're in there to get you in that 15 minutes, then they're not the right person for you. If they're going to spend some time and really look at your body and understand you and get to know who you are from inside out, then that's right. My chiros are now my best friend, because they're really the ones who I promote, I love, and they love me, but they're getting me healthy. And some chiros can see 60 to 80 people a day, which is fine, but you're on a table and, they do adjustments and you're in and out in 15 minutes. People like myself who suffered a stroke or a brain injury or a traumatic event need more hands-on, you need more feel. Mm-hmm. And to be honest, to be true organics, the cream is really what the chiropractors love using, because their hands are so sore at times, and when they apply the cream to their patients, it lasts for 6 to 8 hours, so that adjustment really takes them through the whole day. So in my body in particular, I have what's called the subluxation on my left shoulder. My left shoulder is dislocated because the brain is not sending a signal to the shoulder to keep it in the fulcrum or inside the socket. So what these chiropractors actually have to do is push my shoulder back into the socket at least twice a week, because it just hangs there. and that's sending a signal to my brain saying, hey, wait a second, there's a whole other side of your body here. I'm feeling this, I'm seeing it. And so what they're able to do is go in and just do alignment, and every chiropractor is different. They do come from a holistic approach. It is westernized, but they do, most chiros have in their office deep tissue massage, which is so well needed, acupuncture, and a list of supplements, hopefully some B-True in there, and that's what they really work with. They're allowed to work off the scope, where an MD is so pigeonholed inside their own box. An MD is looking for life-threatening emergencies. Hey, is this guy? They're all about. Is this person either going to die? If he's in that much pain, let me give him a drug. But when I go to my gyros, now whether you have a stroke, a brain injury, or you have a kid who's had seizures, or even with autism, the nervous system is malfunctioning. And these chiropractors know how to reposition the nervous system so it works, it maximizes, and it can help that person. They saved my life. The neurosurgeon and the neurologist saved my life. They do what they had to do, but really it was really the chiropractors and the physical therapists. They put their hands on me. And to be honest, deep tissue massage is probably some of the best stuff, because if you're not going to use a certain part of your body, it's going to weaken, it's going to deteriorate, and it's going to lessen. And unless you stretch those muscles and really work them and get in there and dig in there, it's sending messages to the brain, hey, but it just keeps the body in store. Mm-hmm. Because you will see the my weak side. There's definitely my left arm, which used to be much, much larger because I used to work out, is now much smaller than my right arm. And it's not because I'm not wanting to do it. I just can't use it. So these chiropractors or these masseuses and these physical therapists will go in there and basically dig in there and stretch it, elongate, and then open. So part of my body that will atrophy, especially my calf muscles, and it is the worst pain. The pain is horrific. And you go see your MD, and they're like, here's some Norco, here's some Vicodin, here's some Excedrin. That doesn't do me any good. That might last for an hour, but then after that, I need someone to get in there and stretch my hip flexor, stretch my calf, take my left arm, put it over my shoulder, dig into my quads, dig into my delts, dig into my traps, and really adjust it in a way where it's putting it back into place, but it's letting my brain know that, hey, wait a second here. You still have the left side, because when you have a stroke, the weak side, the brain doesn't realize the weak side. And these chiropractors are basically telling the brain, waking up, going, hey, knocking on the door, going, hello, there's still a whole left side, there's still a whole weak side of the body here that needs to work. And these chiropractors are the ones who are, applying what's called, E-stim, where they kind of shock my body, shock my system into place, because that part of my brain is either dormant or dead. I hate to use the word dead, but it's asleep. And these chiros are the ones who, if I don't see a chiro at least once or twice a week, I'm miserable. I'm in horrific shape, especially with having a dislocated shoulder. I went with my father a couple weeks ago to see my shoulder surgeon, and he's like, I want to fuse my, he wants to operate and fuse my shoulder. Well, even if you were to fuse my shoulder, I still can't rehab it because I still can't move it. And these chiros are like, let's keep working on this. Let's adjust you once or twice a week. Let's get the shoulder back into place. Because if you fuse my shoulder, I lose my shoulder forever. They're basically just going to tie it up and metal it up, and I'm done with surgeries. I'm just done, with all that. I'll do what I have to do, but and so what I'm doing is I'm learning as I'm going along, especially with this blog. I'm learning for myself what works for me that I can give to others like myself who are in need and who are in pain.